There we go. We're live. If you're wondering why the hat, I say this to you. Why not? Shalom and welcome to the Wellness Webcast, also known as Chat with the Docs. If you're wondering why this hat, it's because I got one for you too.
Oh, I get the pointy one. Your best little look.
We're wearing tinfoil hats today because we've been having all kinds of problems with our YouTube feed. And we figure if we're going to be conspiracy theorists, we'd at least be stylish conspiracy theorists.
The only question is, where did they cut us off? When I was talking about the government cheese or when you were talking about the physicians in town?
Well, and here's where it gets frightening. They cut us off as soon as I talked about there only being 3 literate doctors in this town. And then we went black.
Yep.
So, we decided we are going to be conspiracy theorists with a little class.
Oh yeah, we got the cowboy hat underneath that one, keeping it safe.
Going back to my roots,
I gotta tune mine in.
You know how much aluminum it makes when you have a trimmer and you're wearing that silly hat? It makes you sound like a trailer house in the wind. It's terrible.
Do you think we still have a feed, or do you think they cut us off again?
Well, we have 2 people watching. One of them's probably Hero, and the other's probably my wife. So at least we have 2 captive audience members.
We got a shot.
Oh, there's a third one. Good morning, Victoria. So because we got cut off, and we're just guessing at why we got cut off, whether it was the government cheese crack or the literacy rates in Janesville physicians crack, or it could have been Saul down under the river there coming back with a crack.
3 strikes, you're out.
In any case, we decided we were going to redo last week's show. Don't worry, you don't have to suffer through the same tired jokes because they got naps. Anyway, we're going to go through the same stuff because the topic is so important. Mm-hmm. And I did not sit through the whole program because I can't stand looking at myself on video. So we might cover some of the same stuff that you might have seen last week. But we just wanted to go over that whole concept of misdiagnosing. Talked about a patient who went to her physician and asked to get a Western blot, and the physician said, "Well, we must first do the ELISA test, and then if you pass the ELISA test, then we will do the Western blot." So the ELISA test came back negative. Big surprise!
50-50 chance.
Woohoo! You wouldn't even bet on a horse with that. Well, some of you might. You should come in and see me and we'll talk about treatment for compulsive behaviors. Anyway, this particular patient then argued and demanded a Western blot, ended up getting the Western blot, and the Western blot came back positive with 5 of the bands being positive. And some of the important bands is being the positive. And the doctor said, "Well, that still doesn't mean that you're a positive. I'm going to say you're a negative." Why? "Well, because you have to test positive with the ELISA test first." Okay. So as you saw my irritation last week, if you were watching, if you didn't watch it, you should go back and watch it. It was a funny 10 minutes. Lyme disease. What do we know about Lyme disease? It goes well with coconut milk. No, that's lime juice. Do you like pina coladas? That's the only thing I know of that song.
That's all you need.
That's just because it was on a commercial at one point. Anyway, Lyme disease, in 20 to 30% of the patients, they're going to have a false antibody test. Why? Because Lyme disease inhibits the immune system. It automatically tries to throw a damper, a mute on the immune system. Why does it do that? Because it's smart enough to know that it needs to do that in order to survive, because the immune system is what kills it. So it's trying to, it's a little cloak and dagger, you might say, little stealth mode. That's what it's doing. Kind of like we've got different aircraft that go out in the battlefield and they have electronic warfare packages that scramble the radar systems of the enemy. It's kind of what Lyme disease does with your immune system. You really do have to think of this in terms of warfare. 56% of patients with Lyme disease test negative using that two-tiered system, that ELISA test and the Western blot. It's one of those things where this guy may be a very fine infectious disease doc, but I'm going to put this on because I'm going to say something disparaging about a doc, and it's going to go off. He may be a very fine infectious disease doc, but he doesn't know anything about Lyme disease, not even the basics.
Oh, we even talked with the ELISA. That's just to try to save money on the Western blot because it is an expensive test.
Western blot is a little bit expensive, and it's really not that bad when you consider they can charge you $1,500 for a CBC when you're in the hospital. Mm-hmm. CBC might cost $10 to run.
Yeah.
What's the deal? A Western blot, go to a competent clinic, Family Clinic of Natural Medicine in Madison, Wisconsin. You can pick up a Western blot there for $250,
not
plus
bad.
$15 for the lab draw. That's dirt cheap. And these jackwagons are pulling this garbage. Mm-hmm. They're doing it because they don't know how to treat Lyme, and they don't have the humility or the guts to say it. Yes, I'm irritated by it. So, in a study back in 2002, it was published that 52% of patients with Lyme disease test negative on the ELISA, but positive on a Western blot. The data says the ELISA test is garbage. Why are we even wasting our time with it? Because it's an insulative barrier between having to create the diagnosis and having to treat somebody. Meanwhile, what are these poor people doing? They're thinking they're nuts.
It's true. Because they're not helping them. They just refer them out then.
Mm-hmm. They usually refer them out to a shrink, who then puts them on SSRI drugs, select serotonin reuptake inhibitor drugs, antidepressants, anti-anxiety type stuff. And once you start going on those guys, anytime that amount gets adjusted in any way, shape, or form, these people become suicidal. They become hyper depressed. It's a horrible spot to be in, and it's because somebody is covering themselves because they're not about to admit that they don't know what's going on. And because of their prejudice on the issue, they're not going to study it. Bottom line. There, now I have offended all of the AMA and completely isolated us even more. But hey, no cease and desist letters this week. Woohoo! We're on a roll. So, we've been talking about Lyme disease. We've been talking about co-infections. The last several weeks, we've talked about various co-infections, including Bartonella, Babesia, and if we need to go over those again, just let us know. Send us a comment, do something, smoke signal, or better yet, send it on the back of a $100 bill. We'll settle for a $5 bill.
Anything you want.
Send it. Well, I'll keep it monetary.
Well, monetary, yeah.
Preferably not Confederate money, because the South, it's not going to rise again. Get over it. The North, we beat you. It's over. By the way, it's not a good idea when you're in Atlanta to start talking about William T. Sherman and what a great guy he was. That's a nice way to get beat up. That's a nice way to get beat up. William Tecumseh. So, what are some of the other co-infections with Lyme?
Babesia,
Babesia, Bartonella, Ehrlichiosis,
Epstein-Barr.
Epstein-Barr. Epstein-Barr is what? It's a retrovirus, right?
Mhm.
What are some other retroviruses?
Rabies. Is rabies one?
I don't know if rabies is or not. We'd have to check that.
I'm just trying to pull it out now. Like, is that retro? What were you thinking of?
Well, if you
I don't
think
know why I
about
went
it,
there.
if you think about it, rabies is kind of retro because it does throw you back to the 1950s.
I'll have to look that one up because I thought it was. Not for here though. You're not going to get rabies from Lyme that we know of yet.
No.
It hasn't morphed yet into that one.
Some other retroviruses would be like polio. HIV is a retrovirus.
Coronavirus, right?
Coronavirus, I don't think is a retrovirus.
What were they saying for that one? They were saying it was something else.
It's not a retrovirus. It's in the corona classification.
SARS and that.
Yeah. Herpes virus is a retrovirus.
Could hide in the spinal cord, hide in the body.
Retroviruses don't go away, whereas like a coronavirus, a cold, or a flu, or SARS, once it's dead, it's dead. You don't keep continuing to carry it. But a retrovirus, you never get rid of it. It hides, and it can come back. Hence, we have things like post-polio syndrome. But we also have out west, you've got Rocky Mountain spotted fever. You've got Colorado tick fever. Down in Texas, you've got, what is it, the Lone Star fever. Q fever, for those of you who are James Bond fans. Isn't there someone, character named Q or something like that?
Probably.
Okay. There's tick paralysis, tularemia. There's
rabbits, right?
There's a whole bunch of different co-infections with Lyme disease. Because remember, Lyme disease is like Mick Jagger. I know, Saul, you told me not to pick on Mick Jagger, but he's what I think of when I think of Lyme disease. I mean, look at that profile. He never travels by himself. He's got the band members. He's got Babesia. He's got Bartonella. He's got Epstein-Barr. Think of those guys as band members. But then you've got the groupies. The groupies, okay? What are the groupies? Well, the groupies are mycoplasmas, worms.
Thems.
You're harsh, you know that? I'm the lovable, sweet one, and you're the harsh one.
Just ask John.
I can live with that. So you've got this whole group of critters that come into the body with the bite, the tick bite. As we've said before, 40% of tick bites are carrying helminths. Helminths are not her aluminum helmet. No, helminths are the microscopic little worms, little roundworms that get carried in the tick bites. You pick roundworms up in the environment. You can pick roundworms up from walking around barefoot outside. Mm-hmm. You can pick roundworms up from sleeping in the same bed with your pets. You can pick them up by, you ever have a dog sneeze in your face? You said last week you thought it was cute. I hate it when Hank sneezes in my face. The silly dog, we have a big yellow lab named Hank. He's old as the hills. He's as sweet as they come. He's busted my nose about 5 or 6 times. Where, you go down and you put your face by him and he goes, hey! And he clocks you right here and your nose goes click. And then, whoa, it's wonderful. And then you're all swollen up and you look, well, I actually look kind of good with a busted nose. It makes me feel grown up. It's the only time I go to the jiu-jitsu gym and they say, woo. Leave him alone. He's got a busted nose. He's tough.
Yeah, I got this in a bar fight from a yeller lab.
A yeller lab.
But Hank, if he's not going to break your nose, he'll look at you and he'll say, "Oh, I love you," hurt and sneeze all over your face. If the dog has any kind of roundworms in his body, which they tend to be in the lungs of certain dogs, now you've got the eggs going into your face and the microscopic fellas going into your face, and you're breathing them in. It can be in the wind, on the wind, blowing in the wind.
So there's almost no way to avoid them.
You want to avoid those and 1960s protest songs. The four of you that are watching this, I'm really impressed. You're very kind. You're very big-hearted. Thank you. But some of the other bugs that go along with the other worms that go along with this, it's not just the nematode class of worms, the roundworms. You've got the trematodes. The trematodes are not a biker gang from Seattle. The trematodes are flatworms. So what often happens is people get Lyme disease and they get over the acute phase and they're kind of in that slow burn of the chronic phase, and their trematode population's taking off because the immune system is over here looking at the bacterial and viral load and not looking at the parasitic load. I'm not pointing at you saying you're a parasite. I wouldn't do that. So because you have that Th1, Th2 quandary, you've got your immune system can only either do the Th1 response on the parasites or the Th2 response on the viruses and, hey, it's our neighbors, the Th2 response on the viruses and bacteria.
So that's why it's so hard to get rid of.
It's either one or the other. And as the immune system's over here on the Th2 looking at the Lyme and the Bartonella and the EBV, now the Babesia, now the tapeworms, now the flatworms start to take off.
Right.
The immune system jumps over here, starts beating them down a little bit, and these guys go up. And it's a losing battle because your immune system can't do both. So any worm infections that were there to begin with, a tapeworm infection, cestodes, if you want to be really fancy, at the end of the day, a cestode is a tapeworm. How's that for philosophy? It works with, politicians as well. And
the worms really freak me out. That's like the worst part of all this is like that, the worms come with.
Okay.
Just to know that we got them. If you got Lyme in that.
What is amazing to me is the number of critters that can survive in the body, and the body still survives.
Mm-hmm.
The way that God designed your body to be able to survive in a toxic environment with so many things attacking it at once.
Mm-hmm.
That's the mind. It blows the mind. So you can have some of these guys, and most people do have pinworms from when they were a kid, some tapeworms from when they were younger, some liver flukes. But then when they get the Lyme disease, these guys really take off. And then people will end up getting diabetes because the flatworms, the liver flukes, get into the pancreas, and everyone likes to go to the islands, right? Everyone wants to be in the islands. I'm feeling nostalgic. I want to go back to the islands. Well, if you're a liver fluke, you like to hang out at the islets of Langerhans. That's right. You don't need a passport. You don't have to get a visa. You can stay as long as you like. Problem is, when you have these liver flukes living like Cato Kalin in your islets of Langerhans, you're too young for a Cato Kalin joke. By the way, Ford is coming out with their new Bronco.
Really?
Yes.
Square body?
I believe so.
Really?
And they've got the big one, like the old cool ones, and then they got the little one, like the OJ, which is our connection to the Ford Bronco, the Cato Kalin.
I'm not a big Ford fan, but
Now you
I like the square bodies if they're starting to come back with them. I'm all about that.
Where was I before I went on an
Islets
ADD?
of Langerhans.
Islets
and
of
they're
Langerhans.
hanging out there.
So what happens in the islets of Langerhans?
It produces, is it the insulin?
Mm-hmm. Yes, indeedy.
That's with the diabetic end.
And then if your islets of Langerhans are damaged, then you end up with poor insulin production, and you end up with insulin-dependent diabetes, which is how that happens. You clear these parasites from the body, you start giving the appropriate Chinese herbs, the appropriate diet. Many times diabetes can be reversed.
That's pretty cool.
So, all of that said, would you believe we now have 5 people watching? Let's see, John, Mercy Joy, Hero, Victoria is watching. The 5th one's got to be Mom. Ay. So, what we're going to do is we're going to go through a questionnaire. Everybody likes a questionnaire, right? So, we're going to do a parasite infection questionnaire. And you're going to answer never, occasionally, often, or regularly. So,
I don't want them getting my answers. I'm keeping them in my head.
if you answer never, write down 0. If you answer occasionally, write down a number 1. If you answer often, you're going to write down 2. If you answer regularly, you get 3 points. If it's a yes or no question, a no gives you 0 points.
Yes gives you 1.
A yes is going to give you 6 points.
Ooh.
Or 20 points, depending on the question. And some of these questions, instead of regularly giving you 3 points, it might give you 4 points, it might give you 6 points, and I will tell you what number to write down.
I'm going to have to keep mine tallied. I was going to look for a piece of paper, but we'll just keep them going.
Okay,
All right.
So question number 1. Do you have restless sleep? Do you find yourself tossing and turning? Do you wake often? Yes. I'm sorry, never, occasionally, often, or regularly. Never is 0, occasionally is 1 point, often is 2 points, regularly is 3 points. You scored?
Mm-hmm.
Okay. Do you have any skin issues, rashes, itches, hives, eczema? Evidently, our neighbors do. Or do you have acne? And it can be acne on the face or on the body. Never, occasionally, often, or regularly. Do you have frequent diarrhea or loose stools? Never, occasionally, often, or regularly. Do you have alternating constipation or diarrhea? Never, occasionally, often, or regularly. What's interesting about that one is when you see people, that's a good hat on you. When you see, don't walk out into a lightning storm though. It's got that little deal on the top. Makes you look like a German World War I soldier. Yes, Kaiser Wilhelm. Poor man. Did you know he had a withered hand?
Mm-mm.
And his dad resented him because of his disability. And so he grew up being uber macho. And if there was some event, he had to be in it and he had to win and he would cheat and he was ruthless. There's your little worthless history lesson for today. So people that have the alternating constipation and diarrhea, in Chinese medicine, that typically shows itself as a liver pathology, usually liver invading spleen and stomach. We also will often see in those patients a faulty ileocecal valve. That ileocecal valve isn't working, you end up with SIBO as well. Small intestinal bacterial overgrowth, for those of you who don't like college acronyms. That would be me. Okay, back to the
Back to what we're working on here, and lo and behold, the next question is, have you ever had SIBO?
Small intestinal bacterial overgrowth. Do you feel bloated or gassy? Does that happen a lot? Some people will feel bloated, and they'll feel bloated for months at a time.
Is this still the fifth question?
This is the sixth question.
Okay, so that was two separate ones. Okay.
Never, occasionally, often, or regularly. Do you have bowel urgency, or do you have occasional accidents? Do you have, and that's again, never, occasional, often, or regularly. Do you have abdominal pains, cramps, or burning pains? Never, occasionally, often, or regularly. Do you have any rectal or anal itching? Never. Occasionally is worth 2 points. Often is worth 4 points. And regularly is worth 6 points. Do you have any anal fissures? Small or painful tears or cracks around the rectum. You can even think of it as chapped tissue there. Never, occasionally, often, or regularly. That one's worth 6 points. Do you have any gut ulcers or sores or lesions in your gut? Think of ulcerative colitis. Think of diverticulitis type stuff. Never, often, never, occasionally, often, or regularly. That one's the 3-pointer.
Larry Bird.
Grinding of teeth when you're asleep. Have you ever been accused of grinding your teeth when you're asleep? You wake yourself up. That is never, occasionally, often, or regularly. That's a 6-pointer. Do you find yourself picking at your nose or boring your nose with your finger? When you consider that and you look at the people while you're out on the driving around, have you ever noticed how many people are picking their nose, digging for gold? I wish they'd pan for gold instead. But no, they're digging for gold. Almost every stoplight you see someone.
I'm about to watch now.
It's crazy. Well, that's a symptom of a parasitic issue. That is never, occasionally, often, or regularly. Do you have excess, lack of the correct medical term is booger. Do you have excess boogers in your schnoz? Or scab-like boogers in your schnoz? That is, are you ready to score it? Never, occasionally is worth 2 points, often is 4 points, regularly is worth 6 points. Fingernail biting. How many kids do you see biting their fingernails? Someone's always saying, how do I keep my kid from biting their fingernails? We've even tried rubbing hot peppers on their fingers. They can't help it. It's a compulsive behavior brought on by the chemistry and the irritation of these parasites. So, chewing on your fingernails. Never, occasionally, often, and regularly. And yes, I'm still laughing at the fact that you're wearing that stupid hat still.
I told you they're not getting my answers. I'll take it off after we're done. For some of these questions, stays right in here.
I wonder if we were to run an alligator. If we were to run an alligator clip from this to that, I wonder if I could pick up on some of these answers.
I bet you could.
Oh dear. Hey, we've lost one. Someone came to their senses. We're back down to 4. Any vertical wrinkles around the mouth? You see this a lot in middle-aged and older folks. They start getting these, and they say, oh, it's because, out in the sun too much. Not necessarily. It might not even be because you laugh too much. I don't think there's such thing as laughing too much.
I thought I got them.
No, you've got to. You do. You do. You're smiling too much. Shame on you. Become bitter. No, please don't become bitter. That is worth never, occasionally, often, or regularly. Parallel lines on the soles of the feet. It's not because you were stepping on your kid's little toy train track. It's because you have parasites. Never, occasionally, often, or regular. Are you irritable and often for no reason? Never, occasional, regularly, or often. Mercy Joy, you can't rat me out on that one. I admit it. I fall on my sword. I'm a 3. Mood disorders, depression, anxiety, or even suicidal thoughts. Can you imagine the number of people? When we went into this lockdown this spring, we had an entire year's worth of suicides in a month.
Yeah.
How many of those people is because their parasites were irritating the snot out of them? Mood disorders, depression, anxiety, suicidal thoughts, bipolar disorders, whether it's type 1 or type 2, it doesn't matter. Okay? Never, occasionally, regularly, or often. Hyperactive tendencies, nervousness. Don't look at me that way. How many kids get put on Ritalin because they're
All the
ADHD?
It's like they want to.
I'm just glad they didn't have Ritalin when I was a kid. 0, occasionally, often, or regularly. Arctic circles under my eyes. No, dark circles under my eyes. How many of you have a ton of dark circles under your eyes and don't know what to do about it? So then you go on the radio, you listen to the radio, and they're telling you need to buy Genucel and all this other garbage.
It'll get rid of the dark circles.
Yes, it's because your capillaries are leaking, but your capillaries are leaking because of biotoxins and because of inflammation in the body. Cortisol. Some French stuff with stem cells isn't going to take care of the problem. It's going to mask it. 0, occasionally, often, or regularly. That's worth 6 points. Need for extra sleep. You wake up and you feel unrefreshed. That's a huge one. You know how many people come into my practice feeling that way?
Me too. I came to you for help. It's really helping, by the way.
Isn't that neat stuff?
Yeah.
When you're dealing with these infections and you're waiting for the body to clear them and to go through the process of clearing them, there are things that we can do to help you in the meantime. In your case, we gave you some, was it Shazandra Triple Z that we gave you?
Yep.
We checked you out, took your pulses, we tested you. Shazandra Triple Z was going to be the best one for you. Now she sleeps. So if you're waking feeling exhausted, you need all kinds of sleep. Never, occasionally, often, or regularly. I'm sorry, regularly is 3 points. Allergies and or food sensitivities. Ooh, now we're starting to get into that mast cell activation syndrome. When you have these infections, they can cause your body to suddenly start being allergic to everything. Had a patient a while back who just suddenly became very, very allergic to strawberries. And then all kinds of other foods she was allergic to. Come to find out after we did some testing, she's loaded with these guys. That is never, occasionally is worth 2 points, often is worth 3 points, and regularly is worth 4 points. Fevers of unknown origin, just suddenly got a fever and it doesn't make any sense. 0 is never, occasionally, often, or regularly. Night sweats. Night sweats can be due to hormone issues, but not all the time. Night sweats can be never, occasionally, often, or regularly. Do you ever smooch your pets or let your pets smooch you or lick you? You're always smooching your pets. 0 is never, occasionally is 1, often is 2, regularly is worth 4. There's 4 points for Dr. Noel. Do you have increase of symptoms around the full moon?
We talked about that one too a little bit.
Do you grow hair out and get, teeth like the Prince of Wales and a long snoot?
Do the
Obviously, I've got a problem. And knowing you have a problem is the first step to recovery, children. Increase of symptoms. Any of these symptoms. Oftentimes, you'll see a lot of psychosis around the full moon.
Mhm.
Talk to any cop. Talk to any paramedic. Talk to anyone who's ever worked in ER. And they'll say, oh, it's the full moon. Everybody's nuts in here. It's because their parasites are more active around a full moon cycle. The full moon, it causes the tides to move around, but it also triggers these guys to soak up more water in you, and they become more active. When they become more active, they're feeding more, which means they are secreting more
Toxins.
biotoxins, which means you have poison literally in your bloodstream. So, increase of symptoms in the full moon. Pay attention to the scoring. Never, occasionally, often is worth 6, and regularly is worth 8 points. Wouldn't it be neat if we could get Hero to have the sound engineer so he could put all these different sounds in so we wouldn't have to? Well, I wouldn't have to. Anemia, low iron, hemoglobin on blood tests. Some of these parasites, like the Babesia, they actually go after the red blood cells, destroy red blood cells. So if you have anemia, never, occasionally, often, often is worth 4 points. Regularly is worth 6 points. Vitamin B6 deficiency, never, occasionally, often, or regularly. A zinc deficiency, little white spots in your fingernails, never, occasionally, often, or regularly. Inability to count with your fingers. Now, why would you have an iron deficiency, a B6 deficiency, or a zinc deficiency?
They're stealing it from you.
Say that again?
They're stealing it from you.
Louder!
They're stealing it.
I can't hear you!
They're stealing it from you. So then you supplement it. You're just feeding them more.
They love it.
They love it. And they just say, I love you so much. They give you a big, wet, sloppy kiss and, cause more damage. Do you get frequent colds, flus, or sore throats? That is worth 0 for never, occasionally, often, or regularly. Now, why would you get more viral and bacterial-related illnesses?
Because the
Th1 is your immune system's in Th1 mode, and it's focused only on the parasites.
Mm-hmm.
And then any virus, any bacteria can knock on the door and say,
Hey, I think you have vacant rooms.
and they go in and they take over and they start colonizing.
Mm-hmm.
They raise a flag, they dance around a totem, and it's just a downward spiral, and you're sick. Hey, we lost another one. Bye, Mom. It's pretty bad when your own mother says, no, I can't watch this. Have you ever gone barefoot in gardens or parks? Never, occasionally, often, regularly is worth 4 points. I can't do
I
that.
saw 6 and then I got 4.
Have you ever traveled to developing nations? Never, occasionally, often, or regularly. Do you eat pork products? I'm a Jew, I'm exempt from this.
Yes.
Never, occasionally, often, or regularly. Do you ever sleep with pets on your bed? Never, occasionally, often, or regularly. Do you ever eat sushi or raw fish? Never, occasionally, often, number 6, regularly. Do you have any bedwetting issues? And you'll see a lot of these symptoms in kids that are, 10, 12, 14 years old, and they're
Too
still
old.
bedwetting. And you start looking a little deeper, and after you've realized it's not a physiological, it's not a constitutional issue, it's a pathogenic problem. Bedwetting, never, occasionally, often, or regularly. And you can even get this in adults. 40-year-old guys saying, Doc, I don't know why, but I wet the bed occasionally. Well, let's test you for parasites. They score up through the roof on this test. Any sexual dysfunction? Never, occasionally, often, or regularly. And that can be hyper or hypo dysfunction. Forgetfulness. What are we talking about? Oh, never, occasionally, often, or regularly. Slow reflexes. Never, occasionally, often, or regularly. Loss of appetite. Never, occasionally, often, regularly is worth 6. Hungry all the time. You're a bottomless pit, like my son. Hungry after meals. The kid will eat 2 big mountains of spaghetti, and an hour later he's back eating another one. Never, occasionally, often, or regularly is worth 6. Strong sugar or processed food cravings. You just can't get away from it. See a lot of folks with Parkinson's disease with a real strong sugar craving. It's really interesting. Never, occasionally, often, or regularly. Did I just mess up your count?
Mm-mm.
Okay, good. Yellowishness to the skin or the face. A little jaundice. Why would that be the case? Because it's creating an inflammatory reaction in the liver. Never, occasionally, often, or regularly. Do you have rapid heartbeat? You're just sitting there and you feel like you're running a marathon. 90 beats per minute. What's going on? Can trigger anxiety. That is worth never, occasionally, often, or regularly. Breathing problems or asthma. No, none, not ever. Sergeant says, you're a liar. Never, occasionally, often, or regularly. Notice that the breathing problems, the asthma, are a big indicator. Pain in the belly, around the umbilicus, belly button area. Never, occasionally, often, or regularly. Blurry or unclear vision. Never, occasionally, often, or regularly. How about this one? This will tick off all of the optometrists. Eye floaters. How many times have you come in, people complain that, oh yeah, I've got eye floaters too, but my doctor says there's nothing that can be done about that. Never, occasionally, often, or regularly. That's a big indicator of something in the liver. Chinese medicine, when we see floaters in someone's vision, we say, blood deficiency. Now, in GU syndrome, when we're dealing with GU therapy, which is parasite treatment, you look at somebody that has floaters in their vision and you say, what's taking up space in the liver? You think of it more in terms of a space-occupying lesion. Where there's a space-occupying lesion, there's no blood. There's now blood deficiency. Very interesting.
Yes.
Back, thigh, or shoulder pain. Never, occasionally, often, or regularly. Why would someone have back, thigh, or shoulder pain?
They're living in those muscles.
They're living in the muscles, yes. Yes. Yes, they are living in the muscles. We are cultivating the tapeworms in the gastrocs, in the hamstrings, in the quadriceps. Sorry. I think of tapeworms and I automatically think of 1940s horror films. What was the guy with the big eyes, the German guy with the big eyes? He talked like this all the time.
I don't know. I don't know what I'm protecting myself from now, but I'm putting it back on.
Makes you feel better. It's a safe space.
It is.
Do you have lethargy? Nope, we're still holding steady at 4. Do you have lethargy, apathy? Do you have disinterest in life, the world around you? Is that why you're still watching this? 0, never, occasionally, often, regularly. Do you have numbness or tingling in the hands and feet? Well, my doctor says it was neuropathy. Yes, that's what we classify as neuropathy. But do you have it? Oh, I take cap. Do you have it? Yes or no? Answer the question, ladies and gentlemen of the jury. It is a reluctant witness. Never. Occasionally, often, or regularly. Are there menstrual problems? How many times do you have patients coming in with menstrual problems, PCOS, any number of problems? Endometriosis, which
cysts,
endometriosis, you look at that, and that's inflammation. It's almost like there's open sores and scar tissue that's building up around these things. My brain automatically goes to parasites, automatically goes to molds and funguses. It's there. So, do you have menstrual problems? Never, occasionally, often, or regularly. Dry lips. It's really interesting. You start putting some of your patients on these protocols to get rid of these guys, especially if there's candida in their lips dry out, and they're always living on lip balms. Never, occasionally, often, or regularly. Drooling while sleeping. Or if you're my older brother, just drooling in general. Never, occasionally, often, or regularly. Do you have blood in the stool, either visually from like an internal hemorrhoid or from lab work? Dark, tarry stools kind of thing. Never, occasionally, often, or regularly. Have you ever swam in a creek, in a river, or a lake? Never. Look at the scoring. Occasionally, often, or regularly. We just went swimming in Whitewater Lake last week. All the people swimming in there, I can guarantee you there's stuff floating in the water that shouldn't be. Have you ever had a history of giardia, pinworms, any kind of worms, parasites? Never. Occasionally, often. I'm sorry. That's a yes or no question. My dyslexia is kicking in. I'm going onto the wrong line. Do you have a history of giardia, pinworms, worms of any kind, or parasites? That's a yes or no question. If you answer yes to that, give yourself 6 points. If you answer no to that, give yourself a big fat 0. Or a big bone 0, depending on how you want to score it. Do you work in childcare? Do you, or have you ever worked in childcare? If it's a yes, give yourself 6 points. Do you or have you ever had cancer? Give yourself 20 points if that's a yes. Now, score it up. Where are you at?
79.
79. So, on this test, we have the green zone, the yellow zone, and the red zone. The green zone is, there's some stuff, there's some signs and symptoms, but it's not an issue. Your body's doing a pretty good job. Nothing to worry
I'm
about.
guessing that's not 79.
No, that's 0 to 46. 47 to 96 is the yellow zone, which is, we got a problem. And the only reason you don't have major problem is because your immune system's probably focusing on it, which means if you have Lyme or a viral issue, you're probably going to be getting sicker with that. You're probably going to be having a flare. Then you have the red zone, which is the 97 to 264. Got to take my boots and socks off to count that high. The red zone is you have a major problem. And if we don't address this, you're going to be at risk for cancers. You're going to be at risk for all kinds of autoimmune things. You're going to be in trouble. So we address it. Now, how do we address it? We address it by, number one, focusing on making sure that the body is draining, cleaning things out. You don't want to be holding this stuff in.
Better out than in.
Right? So we want to make sure that we are decreasing the transit time of the small bowel and the colon. get this stuff out. We also want to make sure that we're getting that liver bile duct dilated so that anything that's, systemic and gets killed gets metabolized and moved out. The lymphatics are draining out. Then we take a good couple months and we utilize some aromatic herbs, antiparasitic herbs, and something called Mimosa pudica seed, which is just really fun to say. Mimosa pudica. Mimosa pudica. The Mimosa pudica seed is very sticky, but it's also very antiparasitic, and it acts like little scrub brushes, and it goes into the small bowel, and it gets between all the villi, and cilia are little hairs. Villi are little fingers. People get those confused a lot. But it goes in and cleans up around the villi, and it starts bringing this stuff out. Starts scraping away biofilm, starts killing the bugs, starts bringing these things out. And that's when we start seeing usually some really colorful stools, people passing things, worms, people passing little crustacean type creatures, some very, very large creatures like about that look like they are giardia. Large giardia organisms, they're supposed to be microscopic, and then you're looking at something a couple inches long. Fascinating. So once we get that far, then we start looking at what are some of the co-infections? How far into the tissues of the body are these parasites? Are they localized in the gut? Or are they, are your tapeworms hanging out in your gastrocs? They do that. Then we have to use even more aromatic herbs to go systemic. The aromatic herbs are herbs that have, like holy basil. Holy basil would be considered very aromatic, and they tend to penetrate the tissues very well. They get carried throughout the body. And these things carry it out there so that they can start killing the parasites that are in the tissues. Once you go that far, and keep in mind, from phase 1 to phase 3, we could be looking at 6 months. What do you usually see when you talk to your patients about parasites and they've done a parasite cleanse before?
They do it quickly.
I did. I was on one for 2 weeks last year. Did you pass anything? No.
I don't think anybody that I've noticed, because I'm early on in practice still, it's usually not specifically for parasites. It's more to detox, lose toxins, weight. That's more common what I see, I think, until they really start diving deep and finding that this could be a parasitic co-infection.
Mm-hmm.
That's where it comes up, and then you do the real deal. But yeah, I don't think a lot of people necessarily try to rid the parasites that they don't know they have.
And most people don't realize they have parasites.
Mm-hmm.
And you talk to MDs in this country, and they will. Boy, you want to get an MD thinking you're nuts? Just show up with a silver cowboy hat in their office. No, you talk to them about parasites, and they will tell you point blank, we don't have parasites in this country.
And that's not true.
Have you ever turned on the news? Have you seen what's in the State House and what's in the governor's mansions and in the... we got parasites in Washington. We got parasites all over. Why is it that an MD will tell their pregnant patients, don't change a litter box? Why? Because they might get strongyloides. Strongyloides is what? It's a roundworm. That makes it a parasite. But we don't have parasites in this country.
Well, same with what the soft cheeses, lunch meats.
Government cheese?
We got cut off last time. I don't got my hat on. Possibly. So all those things they'll go with that, correct?
Yes. Yes. The bottom line is parasites are part of our environment. They're part of our environment, and to a degree, they're part of your natural biome. In other words, you're going to have them. The question is, has your immune system been distracted by a nasty viral or bacterial infection like Lyme, like Epstein-Barr, fill in the blank? Has your body been distracted and have those guys taken off? What's your risk factors? So I would say if you scored on that assessment that we just did, if you scored anywhere from 47 to 264, we need to talk. Either make an appointment with Dr. Noel or make an appointment with me. And we need to talk and establish what exactly is your infection and what we can do to fix it. And the beautiful thing is, through our methods and training, we can do that very quickly. And it's very cheap to do that testing. The reason we don't do the YouTube closed caption is because the YouTube closed caption is terrible. And when you start using medical terms,
Yeah, it's getting close.
It's there's no telling what they're going to say, and it becomes very distracting for everybody involved. You know what? We said something about government cheese, and then it said our connection's unstable. Imagine that. It's not just the connections that are unstable here. Okay. We have Tom asking last fall he did a parasite cleanse for 2 weeks. Makes sense. Naturopath said that he had some sort of a roundworm infection, very common. He was having gallbladder type symptoms, sharp stabbing pains in the right side, upper right side. If you have sharp stabbing pains in the lower right side, you should get that checked out immediately. That's appendicitis type stuff.
Mm-hmm.
The had sharp stabbing pains in the right side, did a parasite cleanse, didn't do anything. Still has a lot of symptoms. My first question is, do you grind your teeth at night? What did you score on the assessment test? Okay, he scored 108 on the assessment test. I would say, yeah, you're a very good candidate for parasites. And if you are somebody that likes to spend a lot of time outdoors, or if you eat a lot of wild game, you're very, very susceptible to it, as well as Lyme disease and some of these other things that go along with it. Because remember, they never just go by themselves.
No.
Which is why Jerry Lewis would sing the song, "You Never Walk Alone."
Because you're never walking alone with Lyme and parasites and all the good things.
Okay, we're now in our last minute. You have just wasted another perfectly good hour on a beautiful day. And don't get me wrong, we're thankful for it. Thank you for watching. 4 of you have sat through this to the end, which my hat is off to you. It shows your very long suffering. If you have any further questions about Lyme disease, the co-infections, the tapeworm, the roundworm, the flatworm infections, you can contact us on Facebook. You can contact us via email, info@Siloam Center. You can call the office and make an appointment. You can even call and request a free 10-minute phone consult. We'll do that, right?
Yeah.
See? We'll give you a free 10 minutes of our time to talk to you on the phone. So, until next week, thank you for watching. If you worried about the Janesville physicians coming after you, just get a silver hat. It works great. On behalf of the Salome Center, thank you for watching. Shalom and have a great week.
Bye, guys.